NBA star Draymond Green was just suspended indefinitely by the National Basketball Association. I'm Dr. Anthony Collada. I'm a board-certified psychiatrist. I'm here to explain to you the possible mental health reasons, what is going on with Draymond Green, which he was indefinitely suspended. Now, I don't want to sort of poke fun at anyone or kick someone while he's down, but I think this is a good educational topic that can highlight what are some mental health things that can be addressed through mental health treatment. And it likely is considered a mental disorder that Draymond Green is going through because it's interfering his daily life. It's interfering with his work. And so whenever someone's thoughts, actions, feelings impact their daily life, whether it's through work, their relationships, their school, some aspect of their functioning, and there's no medical reason causing it, then in mental health perspective, it is considered a mental disorder that needs treatment. Draymond Green's situation, he's been fighting with his teammates in the past, including punching his teammates. He's been being aggressive to other players on the court, including stomping on some chest, putting people in headlocks or chokeholds. And then most recently, he punched a guy or swung his fist at some guy's head because of the way he was pulling at his jersey. And so in all cases, Draymond basically overreacted. He was overly angry, out of proportion to what the event had. And so there's a few things that can cause this. First, psychologically speaking, this can be related to some sort of trauma in one's life. Sometimes people who are victims of trauma, either emotional trauma, physical, or sexual, they can tend to get very reactive. They can get angry really quickly. They can get easily angered. This can be seen in children who get in fights or grew up being abused. They can maybe get in fights and just black out or not remember what happened. That could be what Draymond Green sort of is going through. He could just be kind of snap and swing like that. Other mental health things that this can be attributed to, but it's much less likely, in cases like bipolar disorder. And bipolar people can get really angry and irritable. But I think that's a lot less likely because bipolar disorder, usually there's other symptoms that go with it, like talking very fast, having a lot of ideas, not sleeping. So I think that's much less likely. But there could certainly be a personality disorder. Some people with certain personality styles, they may tend to react more quickly than others. And so perhaps there's something with his personality that's just causing him to be hard-headed or stubborn or difficult to deal with. Other things that can cause it could be drug use. I don't know his physical condition, but sometimes people are on certain pain meds like opioids. Maybe if he's played basketball for several years, maybe he developed some back pain or some issues with that. And certain pain meds like opioids can cause people to be more moody, more reactive, not be able to control their impulses as well. Other things that can contribute is drugs like cannabis. People with cannabis can tend to not have actual perception of reality or an accurate perception of reality. They can be more prone to anger, more irritable. So if he's using a drug that's having an adverse effect, that could be it. You know, those are just some thoughts that could be contributing. Typically what we use to treat with anger or aggressiveness are medications in combination with some sort of therapy to try to address any underlying problems that could be causing the anger. Different medications can have different approaches, but some mood stabilizers that can help with anger include Depakote. Sometimes there are antipsychotic medications that can help, like Seroquel or olanzapine. Sometimes if the anger is due to post-traumatic stress disorder or anxiety, just not being able to control one's impulses, just an SSRI like Lexapro, Prozac, those are some medications that may help in this case. But I think the consensus of even among his peers and those in the NBA is that, we hopefully he gets the help that he needs. But it does seem like it could be a mental health issue because it's violent, it's aggression that's out of proportion to what the events entail, and it's impacting his ability to function day to day and do his job as an NBA player. So I hope you like this video. Make sure to subscribe to the channel to help support the channel and like this video for more videos like this one.